Hi, I'm Dr. Kate Lakin, an Airrosti certified provider in San Antonio, Texas. Today we're going to be discussing IT band syndrome, which is short for iliotibial band syndrome. This is the most common cause of lateral knee pain in runners. I'll be discussing the symptoms of this injury, the basic anatomy and function of the tissue, traditional treatment options, and how Airrosti is a little bit different. Let's get started. Symptoms of IT band syndrome usually start during or just after activity. They include pain or soreness on the outside of your knee. Now, this is an overuse injury, so it happens with excessive activity. For example, if you've recently increased your mileage in running or cycling. Now let's take a look at some anatomy. The IT band is a dense connective tissue that runs all the way down the side of your thigh. So if you remember, IT stands for iliotibial, which refers to the attachment sites. So it attaches at the top to the ilium bone of the pelvis, the glute maximus muscle, which is your buttock muscle, and the TFL muscle, which is seen here and here. The primary function of the IT band is to provide knee stability with movement. So the primary goal in treating IT band syndrome is to reduce pain and inflammation. Traditional medicine approaches this a little bit differently. They might prescribe the RICE method: rest, ice, compress, and elevate. They might even opt for injections or anti-inflammatories. Some even recommend imaging that can be expensive and not always necessary. Although these treatments can be helpful, they're going to take a lot longer to resolve your injury and get you back to the activity that you love. Now let's take a look and see how Airrosti is a little bit different. Here at Airrosti, we spend a full hour with our patients. We utilize functional testing, range of motion, muscle strength testing, as well as orthopedic tests to help figure out the true cause of the injury. After that, we provide a specific manual therapy to help address some soft tissue imbalances and get you out of pain fast. We follow that up with active care, simple exercises and movements that you can do at home to keep your injury from coming back. I hope this video has been helpful for you. If you've been experiencing any pain or symptoms associated with IT band syndrome, please feel free to reach out to your nearest Airrosti provider so we can help get you out of pain. Thanks for watching. See you next time.